Our final panel of the afternoon is moderated by Dr. David Brindley, University of Oxford and Harvard University, talking about cell, gene, and tissue therapies, applying key lessons from the evolution and commercialization of protein-based therapies. Please welcome David.
Thank you, Anna. Good afternoon, everybody. So today we're going to speak about really the parallels, the similarities and differences between conventional biologic manufacture and regenerative medicine, so the full scope of cell therapy and gene therapy. We've got a fantastic panel, and I'll let them introduce themselves in a second. But obviously, all of us here are used to playing to much bigger crowds, and we want to make sure it's as active as it can humanly be.
We don't take it personally.
And you must hold on to your chairs because the stampede's going to rip them away from you.
It's the quality of the crowd that we get.
But the quality is exceptional, second only to my dear panelists here, of course. Today we have two brief presentations. We have a completely a-commercial, very insightful introduction from Bob to PCT and the great work they've done over many, many years. Then we have a presentation at the end from Lynne with a bit of provocative data, which hopefully will contextualize the panel moving forwards. So we're going to do a very free-form discussion, but we really do want, in all seriousness, some engagement from the audience. And if there are any questions at any point, please do interject. So without further ado, if I can ask the panel to introduce themselves from right to left, as it were. So Lynne, if you can start, we'll finish with Bob, and then Bob can do slides. Thank you very much.
Hi, I'm Lynne Frick. I'm VP of Business Development at a new startup called Isoplexis, which is a Yale Caltech startup working on single-cell technology to predict patient response in CAR-T and immuno-oncology. Most recently, I was actually working on continuous processing, which came up in the last session in biomanufacturing. So this is quite a switch, and so I'm going to relate some of this experience of leaving that world and coming into the cell therapy world, which I think can help people who've been on the other side of the fence understand a little bit more about it.
Thanks, Lynn. So I'm Dave Backer, and I'm with Millipore Sigma, or Merck in the outside of the U.S. and Canada. We have to be very careful there. But we're here in the U.S., so it's Millipore Sigma. I've been involved in gene and cell therapy since the late 1990s, starting out as a CMO specifically for viral productions under a company by the name of Molecular Medicine. We were then bought by Sigma Aldrich in 2007, and then by Millipore Sigma we became part of the company a few years ago. And so I've always been involved in the gene and cell therapy side of things, and it wasn't until recently that I got to see through Millipore how the viewpoint is from the large pharma companies and those service providers for those companies. And they really, really have invested heavily over the years, as you know, in monoclonal antibodies and the tools and the services around that. And I think that it's been very interesting to see what has applied into this space and, frankly, what has not. Some things, virus manufacturing at scale, at bulk, if you have master banks, yeah, you can scale.